Hi, my name is Sydney Munster, and this is my protocol presentation. For my presentation, I chose a lower extremity venous exam. What is a lower extremity venous sonogram, you may ask? It is a non-invasive test where ultrasound technology is used to evaluate the major veins in your legs for a blood clot in the deep or superficial veins. It is a common exam done in vascular ultrasound, and depending on your site, it may be the most common exam you will see. Indications for a lower extremity venous exam is pain, swelling, redness, and warmth. These symptoms indicate to the doctor that there is something wrong with the venous side of the patient's legs and that the blood is having trouble return to the heart from the extremities. Hence why the patient has these symptoms, because the blood is collecting in their leg from the arteries and the venous side cannot get the blood out. Using the correct probe and probe positioning is vital in getting the best diagnostic results. For this exam, we will use the linear phased array transducer or probe. On the probe, there will be a notch on one side. This will help you with the correct image orientation as well as vessel orientations. This protocol begins with transverse, which with correct probe manipulation, the vessels will appear as circles. To obtain these views, you will hold the probe with the notch facing 9 o'clock or to the patient's right. After evaluating the patient's veins all the way down their leg and transverse, we will then evaluate all of their veins in the sagittal plane. This plane, we will make the veins appear as a long tube across the whole screen. To achieve this, the notch will be facing at 12 o'clock or to the patient's head. Now, let's get into the lower extremity venous protocol, or LEV for short. The following images are taken in transverse and with dual screen to show with and without compression. By showing without compression on the left of the screen, you are showing if the vein is circular and anechoic, or black, proving that the vein does not have a clot in it. If the vein has any shade of gray inside the vessel after optimizing the image, that is an indication that there is something in the vein. On the right side of the dual screen, you will show the compression of the vein by first making sure that you are perpendicular to the leg and pushing your transducer into the patient's leg until the vein compresses. This proves to the doctor that there is no blood clot in the vein. If there is any suspicion of a clot by the way the vein is compressing, it is always better to investigate through other methods we will learn later and discuss than to keep compressing. Starting with the right transverse common femoral vein without and with compression, you will obtain this image by starting in the patient's groin crease. You will know you have the correct image when you see the common femoral artery on the lateral side of the common femoral vein, as shown on the left of the screen. When you compress the vein, you will see that the artery remains open even though it is squished. It is not fully compressed to the right of the screen. One way you could better optimize this image is by centering the vein on the left of the screen. To obtain this image from the common femoral vein, you will slide distal until you see the greater saphenous vein coming to join the common femoral vein, which is medial to the common femoral artery. Where they join is called the saphofemoral junction. When you compress, the greater saphenous vein, common femoral vein, and the saphofemoral junction should all compress in the case of no pathology. To better optimize this image, you should center the vein on the left image. As you slide distally from the previous image, you will begin to see a split happen between both the vein and the artery. This is where you will obtain your superficial femoral vein and your deep femoral vein picture as shown here. When you compress, you will only see the superficial femoral artery and the deep femoral artery. This image, the gain needs to be decreased on both sides, as well as clear the vessel borders to get better contrast resolutions. Try to move lateral or medial. To obtain your proximal superficial femoral vein picture, you will slide distal to the previous image. You will see the superficial femoral artery on top of the superficial femoral vein. When you compress the vein, you will only see the superficial femoral artery. One thing that is important to note is you are posterior to the muscle fascia, proving that you are in the deep venous system, because the superficial venous system, like the greater saphenous vein, is in the fascia. To optimize this image, you need to decrease the gain on the right and clear the vessel borders on both, sliding lateral or medial. As you are sliding distally down the thigh, you are compressing every few centimeters to ensure that there is no clot. When you reach the middle of the thigh, you will take your mid-superficial femoral image, where you will see that the superficial femoral artery is on top of the superficial femoral vein, which is below the subcutaneous tissue below the skin, and that when you compress, you will only see the superficial femoral artery. Decreasing the gain on the right would be better optimized this image. As you move distally, you are still compressing every few centimeters. You will stop above the knee right before the superficial femoral vein dives posterior and take your distal image. Here, this image can be difficult to have high contrast resolution due to the muscle and the subcutaneous tissue of the leg. But to better optimize this image, you will slide lateral or medial to clear out the superficial femoral artery and vein to have better visual of the walls. For this image, you will come behind the knee. You know you are at the right place when you see the popliteal vein on top of the popliteal artery. When you compress, you will only see the artery and the compression of the vein will be on top. To obtain this image, you will come down to the calf using the tibia as your guide to find the posterior tibial veins, which you will see is on the medial side of it. You will see one artery in the middle and the anterior posterior tibial vein on top and the posterior post-tibial vein on the bottom. This image could be optimized by decreasing the gain on both sides as well as specifying prox, mid, or distal so the doctor knows where there isn't or is a clot. To obtain your perineal veins picture, you will increase your depth till you see the fibula at the bottom of your screen. Your posterior perineal vein, your perineal artery, and your anterior perineal vein are just anterior to the fibula and just posterior to your PTV vessels. This image could be better optimized by decreasing the gain on both sides as well as specifying proximate or distal so the doctor knows where there isn't or is a clot. The last half of this protocol will be taken in a sagittal plane. This is done to evaluate the vessel in grayscale, color, and pulse wave. These images show the doctor if there's a clot in the vessel or if the color flow, aka blood flow, is being blocked and how much. And finally, the pulse wave images is a way to check the patency of the flow and if the flow is augmentable. By the augmenting, we are proving that there is no clot distal to where we are scanning. Since the veins in the calf are little and not the easiest to locate on some patients, you can take your sagittal color pictures now. Make sure to have your color box angled in the direction your vessels are sloped and to ensure best color fill. You will see the anterior posterior tibial vein on top of the posterior tibial artery and the posterior tibial vein below the artery. The venous flow is going away from the transducer and back to the heart. In this image, it should have been specified prox, mid, or distal. From the previous image, increase your depth to see the perineal veins just above the fibula. The anterior perineal vein is on top of the perineal artery, and the posterior perineal vein is below the perineal artery. In this image, it should have been specified proximate or distal, as well as decreasing the color gain to keep the flow between the walls of the veins. Starting back at the groin crease, you are going to center the vein in the center of the screen and transverse, and then turning on it into a sagittal plane. Here you will see the common femoral vein dive into the external iliac vein. You will also see the outer wall of the vein called the tunica adventitia, and the anechoic part is the vessel lumen. From the previous image, you will add color Doppler to see that the flow in the common femoral vein by drawing a line from the top corner down to the bottom corner that it does not touch. You can tell which side the transducer is on. By the color flow chart, you can see that the flow is going away from the transducer. You can see the tunica adventitia wall of the common femoral vein as well. This image needs to decrease color gain and grayscale gain. From the previous image, you will add pulse wave Doppler. You will see that the pulse wave sample gate will appear and you will place that in the center of the common femoral vein. With pulse wave, we can see the phasic flow caused by respiration variation, as well as when you squeeze distally to give an augmentation of flow. To better optimize this image, you will need to decrease grayscale gain. For the image, you will need to find the saphofemoral junction in transverse and slowly rotate your probe clockwise until you see the greater saphenous and the common femoral vein elongate as one through the saphofemoral junction. You can also see the tunica adventitia of the veins as well. You will most likely have an oblique probe position in this view. From the previous image, you will add color where you can see that the flow is going away from the transducer. The greater saphenous vein is dumping into the common femoral vein via the saphofemoral junction. To better optimize this image, you would decrease the color gain to keep the flow between the vessel walls. Now you will add pulse wave, placing the sample gate within the saphofemoral junction. Based on the color box, you can see that the flow is going away from the transducer. In the spectral Doppler, you can see that the flow is below the baseline, and indicating that the phasic flow is going away from the transducer as well. For the superficial system, you do not need to augment. To obtain this image, you will slide distal until you see the superficial femoral vein and the deep femoral vein split, making sure your focus is aligned with the deep femoral vein. Sometimes when you get to the split, you can see the arteries as seen here. The superficial femoral artery is lateral to the split. From the previous image, you will add color. Because of the way the superficial femoral vein and the deep femoral vein are sloped, you will face your color box the other way, changing the flow to going towards the transducer and the flow in the superficial femoral artery going away from the transducer. Now you will add pulse wave, ensuring that you place the sample gate in the deep femoral vein, not the superficial femoral vein, which is medial to the superficial femoral artery. Because the deep femoral vein is difficult to augment, you just need to show phasic flow to prove that there is no clot. The only thing that needs to be changed about this image is specify that you are in the deep femoral vein. Keeping the same position as the last few images, you will take your proximal superficial femoral vein picture, ensuring that your focus is at the level of the superficial femoral vein and not the deep femoral vein, which is just medial to the superficial femoral artery. Next, you will add color, showing the superficial femoral vein and the deep femoral vein have flow going towards the transducer, and the superficial femoral artery has flow going away from the transducer. This is correct flow direction. Next, you will add pulse wave Doppler, placing the sample gate in the superficial femoral vein, not the deep femoral vein. You will show in the spectral Doppler distal augmentation and the return of phasic flow after it. Sliding down to the middle of the thigh, you will take your mid-superficial femoral vein image, which is just medial to the superficial femoral artery. You can also see the tunica adventitia of the vessel and the vessel lumen within the vein. Next, you will add color to the superficial femoral vein, showing that there is flow going away from the transducer. To ensure better contrast resolution in the superficial femoral artery and vein, move medial to the muscle for better penetration. When adding pulse wave, you can always double check that you are in the superficial femoral vein instead of the superficial femoral artery by the flow on the spectral Doppler being phasic and augmentable, not pulsatile. For this image, you will slide down to the distal thigh or above the knee to take your distal superficial femoral vein image, ensuring that you see the tunica adventitia layer of the wall and the vessel lumen as anechoic. At the top of the image, you can see the skin line. To better optimize this image, you should increase the near-field gain above the vessel. Next, you will add color. With the natural dive of the distal superficial femoral vein and the superficial femoral artery, the color box will indicate that the flow within the vessel lumen is going towards the transducer. To better optimize this image, you should increase the near-field gain and decrease the color gain to avoid aliasing outside of the vessel lumen. Next, you will add pulse wave to your color picture, placing the sample gate inside the superficial femoral vein. You can see an accessory vein dumping into the superficial femoral vein. In the image, the color box indicates that flow is going towards the transducer, and due to this, you may need to invert your spectral Doppler so the augmentation is below the baseline. For this image, you will come behind the knee in the popliteal fossa, where you can see the proximal popliteal vein on the left of the screen and your distal popliteal vein on the right of the screen, the outer layer of the vessel wall, which is called the tunica adventitia, and the anechoic vessel lumen. Next, you will add color, where you will still see the proximal popliteal vein on the left and the distal popliteal vein on the right. On the distal portion, you can see the anterior tibial vein dumping into the popliteal vein, and the flow is going away from the transducer. To better optimize this image, you should decrease the grayscale gain. Finally, for the pulse wave image, you will place your sample gate within the popliteal vein, where you will see phasic flow before your distal augmentation and the continuation of phasic flow after your augmentation. To better optimize this image, you should decrease the grayscale gain and increase the color gain to have better feel within the vein. If it is a bilateral leg exam, you will follow the same protocol for the left leg or contralateral side, as well as follow the same probe positioning. But the anatomy will look flipped horizontally because the vein in instances of normal anatomy is on the medial side of the artery. Thank you for listening, and these are my references.